Okay, welcome back, guys. This is chapter 32. This is diet therapy and special diets. So let's just move right along and talk about special diets. So, nutrition is a vital component of therapy for lots and lots of different disease processes. Some kinds of disease processes or disorders necessitate a special diet. So it's important that we understand the different types of diets. Eating is an event, it should be treated as a pleasant event. And when people are sick, sometimes they go back to kind of sometimes maybe childhood behaviors and getting picky about food. So we need to keep that in mind. When we're serving food, you want to make sure that it's the patient's food. If the patients can feed themselves, you give them their trays first, and then you take the clients that need to be fed their tray. Um, you don't, this is basically common sense stuff. Fill the cups and glasses only three-fourths full. You don't want any accidents. And be pleasant. Take a minute to say hi, how you doing? That's really important for these people. Um, you want the food to look as appetizing as possible. Bad enough that they're in a facility, try to make it as comfortable and appetizing as you can. Oftentimes you'll see supplements. So between meal supplements or snacks. Sometimes people with different nutritional needs or bad appetites will get supplements or snacks, usually ordered by the doctor, and these need to be served on time. Okay, that's important. And document that they received it. Okay, that's also very important. Okay. Um, Sometimes you'll have an order to force fluids or encourage fluids. Sometimes fluids will be restricted. If somebody needs to have fluids encouraged, every time you go in the room, offer them something, little sips, right? Um, and try to give them, if you can, something that they like to drink, right? Keep a water bottle or water cup handy, for them, and make sure that they have enough fluid available to them. It's easy to get to. Now, if it's a fluid restriction, right? Sometimes the healthcare provider will write for fluid restriction, like somebody with CHF, restrict fluids to 1,500 mils a day. You want to try to space them out. So, because 1,500 mils would be 3 water bottles. Each one of them is about 500 mils. So you want to space that out during the day. Um, I&O. Sometimes the doctor will order intake and output. So everything that's a liquid in and out has to be measured. Liquids could be soup, different drinks, Jello, right? Jello is considered a liquid. Output, measuring urine output, vomit, if they have a wound drain, if they have an ostomy, all those things are measurable and need to be documented for the intake and output. As nurses, not only do we reinforce diet teaching, but sometimes we act as dietitians or nutritionists. We're going to give patients verbal or written instructions or both. Sometimes patients have religious or cultural beliefs that can be conflicting. We want to make sure that we find out what is important to that client so that they have, freedom of choice as much as possible. And when we're talking about clients who need assistance with eating, always encourage as much independence as you can. Let them do whatever they can do, even if it takes a little bit longer. Okay, that's important. If somebody's visually impaired, blind, or legally blind, oftentimes they can eat without assistance, but you would need to tell them so where the location of the food is, just like the face of a clock. So the plates in front of them, 12 o'clock, 1 o'clock, 2 o'clock, right? You would cut the food up for them. If it's a sudden onset of blindness, they may not be able to do that, so you'll have to feed them. Dysphagia, okay? Dysphagia, that means difficulty swallowing. I'm going to put that here, difficulty swallowing. Okay. Um, Speech therapists should be consulted to make sure that they're not going to aspirate. So sometimes we have to thicken their liquids, nectar or honey thick. We're always going to consult with the dietitian and make sure their diet is nutritionally adequate. Head of the bed, elevated. Patients should be fed slowly, and they should perform a chin tuck when they swallow. Bring the chin to the chest. Reason, chin tuck will help shut the epiglottis and help to prevent them from aspirating. Or aspiration means to have food go into their lungs instead of into their stomach. Okay. For people who can't chew, who have difficulty chewing, could be because they're edentulous. That means they have no teeth. Could be because they have ill-fitting teeth. You want to make sure that We're contacting social services, let the doctor know, et cetera, and documenting any reports of any problems with eating, appetite, refusing food, difficulty swallowing, nausea, vomiting, any of those things. Okay. Is the following statement true or false? The nurse should always ensure each client's meal tray has the correct food before going into the room. If you said true, you'd be right. Yeah, always make sure that it's correct. So let's talk about different diets. So we can talk about the first one, which is a house diet or a regular diet or a general diet, full diet. All means the same thing. It's just a basic regular diet. There's no restrictions on the diet. Wide choice of foods. This is for people, again, who don't require any type of specialized diet. Okay. But now some people require specialized diets, therapeutic diets, because of a disease process that they may have. Okay. And therapeutic diets can be actually ordered as part of their treatment. So let's talk about therapeutic diets. Liquid diets. We have clear liquids and then we have full liquids. Okay. A clear liquid is anything you can see through. Also, it's a liquid at room temperature. So Jello is the first thing that comes to mind. Jello, tea, coffee, broth, juice, apple juice, etc. Sodas, popsicles, not orange juice, not grape juice. Those two things have pulp. Okay. So they are not considered clear liquids. But remember, if they're on a clear liquid diet, it's usually only temporary because it's not enough calories or protein or other nutrients. So it's usually temporary. Full liquid diet is a clear liquid diet, just add dairy. So you're just adding dairy products. So they could have black coffee with a clear liquid diet. Well, now with a full liquid diet, they can have coffee with cream or milk in it. And then they can have milkshakes, ice cream, that kind of thing. A soft diet. Sometimes, again, people having difficulty chewing. That could be things like mashed potatoes, applesauce, and their foods would be pureed, put into a blender or a food processor, like baby food almost. Mechanical, soft, chopped, bland, low in fiber. These are all different diets. Then there are restrictive diets. Here's an example, and this one you'll need to know forever. The DASH diet. That is for cardiovascular disease. It has 1,500 milligrams of sodium, low in fat, low in cholesterol. Okay. And that's a very important diet to know. So if somebody asks you, what's the DASH diet? It's restricted 1,500 milligrams of sodium, low fat, low cholesterol. Okay. Then we have high fiber diet and we have low fiber diet. So a high fiber diet sometimes can cause problems like cramping or diarrhea or lots of gas, but they may need additional fiber in their diet. A low fiber diet is a low residue diet. That means the same thing. That would be no seeds, no nuts. Usually this is for severe diarrhea, colitis, diverticulitis, other GI disorders, intestinal obstructions, and that type of thing. If they had an ostomy put in, right, they're going to have a low residue diet ordered. A bland diet, that means no spicy, right? And that's often prescribed for ulcers or esophagitis, gastroesophageal reflux disorder, gastritis, hiatal hernia, etc. The goal is that the gastric acid that's produced in your stomach with a bland diet will be at a minimum, right? So they have to avoid alcohol, caffeine, even decaffeinated coffee and tea they shouldn't have. Red pepper, black pepper, chili powder, fried foods, foods high in fats, peppermint, spearmint, citrus fruits like orange juice and grapefruit juice, tomato products, very acidic, and discourage milk. Because even though milk seems like it would be nice and comforting to the stomach, it actually causes the production of lactic acid after you drink it. So, not milk. Some people are on a high calorie diet for people that say are underweight, people that have hyperthyroidism or severe burns to their body. That would be 3,000 or more calories a day. High in protein, carbs, fat, vitamins, minerals, small, frequent meals. Small, frequent meals. Small, frequent meals are the key to life. That's probably the answer to the question. Small, frequent meals. Don't forget that. That's good eating advice for almost everyone. Diabetics, healthy people, everyone. Reduced calorie diet. Well, that would be somebody that's trying to lose weight, right? And so you've got to take in less calories than you burn or than you use. And it's usually including healthy carbs, lean proteins, and healthy fats, the good fats. Carb control diets. So for diabetics, the goal for diabetics is to maintain the blood sugar at a nice steady level. That prevents complications. Okay. Some diabetics will count their carbs. Um, the bottom line is that they need to be eating small, frequent meals, and it needs to be a consistent amount of carbs, and it should be the good carbs, not the bad carbs. In other words, the brown carbs, the long acting carbs. That keeps their blood sugar stable throughout the day. What we don't want is these peaks and valleys, blood sugar up, blood sugar down. Not good. Causes lots of complications. And diabetics don't need special foods, right? They just need to watch the intake of carbs because diabetes is all about the carbs or the sugars. Okay. And then we have lactose restricted diet. So somebody could be lactose intolerant. Most people can tolerate yogurt. Even the lactose intolerant people can tolerate yogurt, but not ice cream or milk or those kinds of things. Um, for real severe cases, they have to avoid even foods that have milk in them, okay, because that can cause a reaction. That's usually diarrhea. Fat control diet or low fat diet. Somebody's got hyperlipidemia, high cholesterol or triglycerides, which all contribute to coronary artery disease and heart attacks. No trans fat, no saturated fat. Okay. A low fat diet, malabsorption syndrome, pancreatitis, gallbladder disease, dumping syndrome. And also, when we talk about gallbladder disease, cholecystectomy, which is the removal of a gallbladder. Okay. If the patient eats fatty foods after a cholecystectomy, they will have steatorrhea. They will also have pain. So after a cholecystectomy, we have to introduce fats in very small amounts. And their total fat, regardless of what kind, should be limited to 25 to 30% of the total calories in a day. High protein diet. That's, some people need a lot of protein. Animal products are the highest source of protein. Protein supplements, protein shakes, or soy, right? Then we have protein restricted diet. So people that have kidney failure will have protein restrictions. And we have to be very careful. The amount of protein that they need is based on their weight. So that's a calculation that will be, figured out for you. And then there's the celiac disease, gluten intolerance or gluten restriction. These people can't have wheat, rye, oats, or barley. You must know this. They can have rice, but they can't have wheat, rye, oats, or barley. Okay. And if they eat these things, they wind up with diarrhea, right? Pain, abdominal pain, cramping, that kind of thing. And this is something that you have from an early age. You typically don't wake up in your 40s with celiac disease. So again, gluten restricted diet, that's celiac disease, no wheat, rye, oats, barley, but they can have rice. Sodium diet, sodium control diet, that's for cardiac cases. The high end of normal is 2,000 milligrams a day. Moderate sodium restrictions about 1,500 milligrams a day. Nobody needs more than 1,500 milligrams of sodium unless you are working outside in the heat and sweating a lot. Then you may need some additional sodium. Patients that have cardiac issues can use salt substitutes as long as they're not potassium chloride. So the salt substitutes that are available on the market, the ones that look just like salt, they are made from potassium chloride. Cardiac patients may not use those. They can use things like Mrs. Dash, right? That's spices. So it doesn't look like salt or taste like salt, but it can replace salt. Other things like garlic, can replace salt. So you want to have them get creative with other spices because the salt is very bad. There's calcium or phosphorus modified diets, usually for renal failure. Potassium modified diets, renal failure, right? Um, Diets modified by serving size, that's not common, but I will tell you this, 6 meals a day instead of 3, and I'm just going to put some stars next to that, is the best way to eat. Best way to eat. Then there are diets that are modified because of allergies or allergens. So people that are allergic to eggs or chocolate or grains or nuts, peanuts, specific fruits, those kinds of things, they would have to eliminate those from their diet. Okay. The nurse is caring for a client who has had hip surgery 24 hours ago. The healthcare provider has written the order to advanced diet is tolerated. Which type of meal will the nurse request that the client has tolerated the last meal, which was clear liquid? We advance from clear liquid to full liquid. Okay. That is the progression. I'll be, I'm recording. Yes. Okay. Let's see, where am I? Okay, right, full length. Now, tube feedings. Let's talk about tube feedings. Enteral feedings. People sometimes have a percutaneous gastrostomy tube, a PEG tube, or a jejunostomy tube, a J tube. Why? Well, sometimes they've been in an accident, they've lost consciousness, they're not able to eat, so the food can go directly into the GI tract. Burns, severe burns if they were on a fire, infection, etc. Those kinds of things. I am going to pause this for 1 minute and see what's going on. Okay, let's finish this up. Let me share my screen and let's finish up this PowerPoint. We are at the end of it. Okay, so we were on enteral feeding. So a PEG tube is a percutaneous gastrostomy tube. There's also a J tube that goes right into the jejunum, which is part of the small intestine. There are different types of formulas for tube feedings. We're not going to get into all of that. There's also a nasogastric tube, which goes through the nose into the stomach. Okay, and these are all the different types of tubes that we can use to feed patients. Endoscopic tube, gastrostomy tube, like I said, the percutaneous gastrostomy tube. Don't worry about the button feeding device because you're not going to see those. Here you can see the three types of tubes. Here's the NG tube, goes through the nose, the one nair down the esophagus to the stomach. A G tube, which is a gastro tube or a percutaneous gastrostomy tube, goes directly through the skin into the stomach. And the J tube goes directly through the skin to the jejunum, which is part of the small intestine. Okay. Um, so there is tubing that comes from a bag. You put the feeding in the bag and you attach the tubing to this little adapter thing that comes from the patient. And it's usually run on a pump. The head of the bed should always be elevated 30 to 45 degrees when the client is receiving a tube feeding so they don't aspirate. In other words, so that it doesn't go into their lungs. And then there's one more thing called TPN, total parenteral nutrition. That is when we have to bypass the GI tract completely, and it's going to go through a central line like a Mediport or a PICC line, which you'll learn about. And that should be managed by an RN. Okay. And then these are food medication interactions really quickly. Just know grapefruit and grapefruit juice does not like a lot of meds. Here's the list: cholesterol meds, cardiac meds, anti-anxiety meds, cardiac meds, thyroid replacement drugs, et cetera, et cetera. Green leafy vegetables and warfarin, black licorice, salt substitutes, tyramine containing food, MAO inhibitors, which are antidepressants. So, and we will learn all these as we go. So you won't be tested on these. Is the following statement true or false? The bed should be put flat when the client receiving a tube feeding. If you said false, you were right. The head of the bed's got to be up. All right. That was another quick one. Just make sure you know your clear liquids, your full liquids, cardiac, sodium restricted diets. Hope you had a good time and I am done. So let's stop the share and stop the video and we're done. Bye.